5 ways to choose a functional health doctor. Number 1, let's get into the nitty-gritty. It's going to be about costs. Functional health doctors, you often have to pay yourself out of pocket. They're not covered on any free healthcare system that you may have in either England or Canada. They won't be covered under your insurance or any extended medical. Number 2, you want a doctor who's got a lot of experience with your disease or illness. You want to check out their website, find out services they offer, different therapies that they can provide, different treatments that might be available. You want to check out the reviews for your doctor on reputable sites. Number 3, you want a functional health doctor who's a licensed practicing medical doctor in your location or area. They also want to have additional functional health qualifications from places like the Institute of Functional Health in North America, and there are different ones across Europe. If they've any other additional qualifications or specifications, particularly if it's to do with your illness, how many years they've been practicing for. Most functional health doctors have been practicing for many years. Number 4, their treatment approach. This sounds really flim-flammy, so I'm going to be really specific. You're going to want to know how many days they're available for during the week, how much time you get with the doctor, how many hours a week or month they can provide to you, what happens when they go on holiday, is there somebody else to cover, or are they practicing in a small surgery? You may be looking at a functional health doctor for a couple of different reasons. You may have had a very quick diagnosis and have very little time to get second opinions or get extra testing. You may be choosing to do that for yourself. Another reason may be that you've had bad experiences or medications, surgeries that haven't worked for you in the past, and you're looking for more in-depth care from a functional health doctor. It may be the fact that you've got a chronic health diagnosis long-term, and you want somebody who's going to give you the best care you can over a long period of time. Whatever the reasons are, you come to looking at a functional health doctor. There are certain things that you're going to want to make sure you're aligned with. If you're very chronically ill, you want to understand what kind of treatments they can give you, what kind of resources you have that your doctor can utilize. Do you have money to have in-home care, extra treatments such as physio? You may be looking for a functional health doctor that's going to look at you as a whole, which is what they do, rather than just treating a symptom. But it'll also be able to suggest lifestyle changes, things that you can do if you choose to be proactive about your health and what you want to do. If you're coming to end of life care, then you really want to be careful about having that doctor acknowledge what's important to you. Are you better in palliative care? Would you prefer to be at home? What resources are available for you to do that? What are the costs involved? You may want to pick a doctor who is as proactive as you are on trying to reduce your medications, get lifestyle changes that may help you reduce your symptoms, pain, brain fog, exhaustion. And that may mean not over-prescribing or not prescribing things to you. If you've had a bad experience, you may want a doctor who believes you when you tell them how you're responding to this medication or treatment. Number 5, what you want to achieve by having a functional health doctor. Is it specific symptom that you're trying to get dealt with? Is it long-term medication and care for a chronic illness that you will always have to manage? Is it support in your choices, decision-making around very serious issues you may be facing? If you've had a chronic disease diagnosis, you may well be having to face some very difficult questions about the type of care you'll get and how you're going to get it, where you're going to get it, how much that may cost, and who can support you. A functional health doctor will also hopefully have resources to be able, and the time, because you're paying them, to look into different options that might be available to you. They may be the second opinion that you're wanting. I hope this video has been helpful in choosing a functional health doctor. My next video is going to be about the difference between functional health doctors and standard general practitioners or doctors, whatever the word is you use for them. And I'm also going to be doing a video on what to take with you to your appointment when you're seeing your doctor after you've had a diagnosis. I wish you all the best. See you in the next video.